Good day, everyone who's watching us right now live. Wherever you are in the world, we welcome you on our day three on Clinica Summit. I would like to take this opportunity to thank each and every one of you, from our special guest speaker to our internal technical consultants to our marketing team and staff, and most especially you who is watching us right now live. Thank you for collaborating with us on this prolific event. My name is Butch Esmero, and I'm the CEO of Clinica Technologies. I will be your humble host and speaker for this day. Hold a minute, I'm going to share my screen. So, for our topic for today, for this day, is all about healthcare interpretability. So, what is healthcare interpretability? According to HIMSS.org, um, healthcare interpretability is the ability of different information system, devices, and application system to access, exchange, integrate, and cooperatively use of data in a coordinated manner within and across organizational, regional, and national boundaries to provide timely and seamless portability of information and optimize health of individuals and population globally. So it is clear from its definitions, there are so many factors evolving around this healthcare interpretability. And we are not only talking about the data infrastructure, but the synergy of actions and counter reactions of the opposite processes with a good sense of synchronization and common end goal. Sounds complicated? Okay, I'm going to make a very simple case scenario of the current healthcare interoperability in Australia. So, why Australia? Well, aside from having a great universal healthcare scheme since 1984, Australia is proactively enhancing their capabilities when it comes to digital healthcare in recent years, and also with a good legislative support from the government. They do have many programs in line with these objectives. As I mentioned earlier, a good execution of healthcare interoperability requires synergy from various groups working cohesively for a common end goal. Okay. According to digitalhealth.gov.au, from their strategic interpretability report of 2017, healthcare interpretability requires four main participants. First, the government. So the government, this is a group of comprises federal and state governments with a focus on healthcare policy, programs, and other key related policy domains, including safety and quality and digital standards and privacy. Second is the industry and peak bodies. I call this the health tech industry. This is a group comprises of suppliers such as large and small software vendors, system integrators, and other vendors, industry peak bodies, and other key participants such as standard organizations. Third participants is the clinicians and health and well-being services. This group comprises of public and private sectors, health and well-being clinicians, including general practitioners, practice nurses, hospital, clinicians, administrative staff, allied health professionals, specialists, aged care personnel, pathology and diagnostic labs, and others. And last is the consumers and carers, also known as the health patients. This group includes individuals and carers who access the health being services. Okay, so interoperability is not all about technology. It's all about people being willing to work together, collect, share, and make better use of information we have available. Interoperability relies on set of national capabilities and set of environmental factors. Better interoperability will improve the service delivered by clinicians and services received by consumers. It allows people with severe access issues to readily interact with the healthcare system. It allows clinicians to easily transfer and access shared information, improving the way services are provided. So Australia has had a great understanding of this initiative of healthcare interoperability since 2017. Now, let's dive into specific levels on how Australian healthcare implement the strategic interoperability as of this very day. Let's start with the universal benefits in Australia. On the far right side of your screen is the Medicare Benefits Schedule, or MBS. So MBS is the listings of Medicare services subsidized by the Australian government way back in 1984. In other words, this is a Commonwealth-funded health insurance scheme that provides free and subsidized healthcare service to Australian population. On the data side of things, MBS do have a list of codes associated with clinical categories. The MBS code was maintained regularly, updated, and facilitated by the government. They do have the ability to mandate its service value or clinic procedures charges in accordance to the national or regional economic compliancy. The second column next to the government is the industry peak and peak bodies, or in this case, this is also known as the private company and software industry partner. The Australian government provides a strategic alliance from the private firm to redistribute its fundamental service, which is all about MBS, to the direct consumers or even the direct software vendor. They provide APIs for MBS bulk claims to process for the clinicians and GP. Sample of this company is claiming.com, ACSS Health, BIJIB, PTY Ltd, and many more. On the third column is the clinicians and health and well-being services, or in this case, it represents clinics, GPs, and medical professionals with an MBS subscriptions. MBS codes help the aforesaid groups to acquire bulk bill payments with much easier and organized centric process. And last but not least, the consumers and carers, which benefits them greatly on accessing a wide range of health and hospital service at low or no cost. On the data side of things, any transaction occurred, the data will now be synced in their My Health Records account. So we see how the poor participants simultaneously interact and exchanging information with one another in order to achieve common goal, which is to facilitate and subsidize healthcare service in Australia, from the implementations to integrators, to executors, and to the patient benefactors. The data sets such as MBS code, clinic messaging system such as the Australian standardized HL7-V2 or version 2, and the My Health Record. So these are the data that is being interpretable. So you see at the bottom. So I put that in the symbol. Okay. So next will be. So the next will be The next entry that I'm going to discuss is PBS, or the Pharmaceutical Benefit Scheme. PBS is designed to provide safe and affordable medicine to all Australians. Under the PBS, the government subsidized the cost of medicine for most medical treatment. Unlike MBS, which is all about subsidizing medical treatment and process, PBS, on the other hand, is all about pharmaceutical products, the one that is prescribed to you once you get out of your treatment. Similar to MBS, PBS also does have a code of its own, which is maintained and regulated by Australian government. The government also provides APIs and other programs for other private companies to connect and facilitate direct service to the consumer, which you're seeing right now on the next column. Private industry facilitates electronic transfer of prescription services, or ETP. Electronic prescription is now being rolled out. It is much more secured through the usage of QR codes. Issuance of prescription can be done remotely by clinicians who were PBS subscribers without the face-to-face interaction to the patient. All the digital or paperless prescription were also in direct sync with the My Health record of the patients. So you're looking at, again, on the bottom, we saw lots of data that was being interpretable across the 4 participants. We got PBS codes, HL7-V2, ARTG. ARTG is basically the data that for registered drugs in Australia, also available for integrations, and the My Health record data. Next in line, hold on, okay. Next in line is the SNOMED CT-AU1 and Australian Medicine Terminology, or AMT. So this is the Australian version of SNOMED, contains more than 50,000 procedure terms, not all of which are relevant to surgical settings, but this module is created by Australian Digital Health Agency to promote standardizations of language and terminology. And these standards become the guiding principles of the software developers to integrate in their EHR system. For clinicians in Australia, it improves the communication in EHR, which gives them the real-time decision-making for decision-making. For the patient, it facilitates early identification of emerging health issue because of the optimal time that it saves. So I don't want to get into the details of SNOMED CT-AU and AMT. So if you guys are interested in this topic, you can basically check their website at www.snomed.org or at the www.digitalhealth.gov.au for more advanced information. Next is the ICD-10-AM. ICD-10 is the International Classification of Disease, which is the ICD stands for. It is designed to promote international comparability in the collection of processing and classification of disease and related health problems. ICD-10-AM was developed and maintained by the Australian National Centre for Classification in Health, or NCCH, and it's much more modified by the permission for Australian government purpose, which is the multi-axial classification based on the Australian Medicare Benefit Schedule, or the MBS. So just like SNOMED CT, ICD-10-AM became a standard prerequisite within Australia. So if you are a software developer of electronic health record or project management system, and your product will be distributed locally in Australia, you have to conform to these standards. Same goes with clinicians who usually prepare the physician's documentations. Standardization is the fundamental requirement to avoid any misinterpretation by any third parties such as auditors and attorneys. And last will be the pathology and diagnostic imaging. The Australian government also in charge with the conformance and clear guidelines to all private companies groups who also vested in pathology and diagnostic imaging service, which in the present time does have the ability to check your lab results or x-ray directly sync on your health records. A digital copy of your pathology or a digital copy of your pathology test results. Okay. So overall, Australia covers all the necessary factors for healthcare interpretability and still continues to grow as of to this day. Government facilities, standardizations, and conformance, and at the same time provides opportunity for strategic partnership with the private sectors. On the other hand, the private sectors provide innovations and compliance for developing products and services directly or indirectly to the consumers. Clinicians act as the main principal driver of all these initiatives, and the patient must partake in all of this endeavor as the prime benefactors of this healthcare interpretability. So if we're going to imagine this Australian healthcare interpretability as the grand scale of things to our localized ecosystem in Clinica Technologies, this is how we're going to adopt things. First, the government as a technological provider, we must comply with all the regulations and programs issued by the Australian government. For the private sectors, we can represent this as the modular application that we build. Private sectors tends to be the forefront of innovations. Each of them had its own specialty and uniqueness when it comes to services. Same as our modular application. Each one of them specialize in different areas of services and with each internal enhancement and features. They can run independently or they can be clustered together as a unique system. For the clinician, this would represent our main client user, which is the medical practitioner, clinics, and GPs. We really have to make sure that whatever we've been doing so far in the past few months when it comes to applications development and R&D, we should always follow the principle of domain-driven design, specifically adapting and continuously improving the needs of this particular user group. And last but not the least, the patient user. Our product should always have a patient-centric user in order to complete the 4 participants in the healthcare interpretability. All of this should run in a data which is interpretable across modules, across users, and across other domains. So this would end my discussion of healthcare interpretability. Hopefully you enjoy my presentation. And for those who are willing to reach me out and ask some questions, feel free to message your queries on the Zoom chat. Or you can email me at support at clinica.dev, or you can call me at 9646-9504. Thank you and cheers, everyone.